everyone. Before I get started, I would like to read the disclaimer on your screen.
Good evening, everyone. Sorry for the delay.
The PharmAssist virtual learning experience, brought to you by Mandel's Clinical Pharmacy, is intended only as an educational program for patients. Any clinic-specific information shared by the nurses is the opinion of the nurse and is not intended to replace the recommendations or requests of your healthcare professionals. All medications will be dispensed by Mandel's Clinical Pharmacy according to the prescription as written by the provider. Thank you everyone for tuning in to the PharmAssist virtual learning experience. This is the first online live pharmacy medication instructional program, and it's brought to you by Mandel's Clinical Pharmacy. This educational program brings you together with outstanding healthcare professionals right from the comfort of your own home. My name is Tony Newman. I'll be your host tonight. I've been a nurse for 10 years in the New Orleans area, with my last 3 years in the fertility world. PharmAssist takes place every Monday at 7 p.m. Eastern. Tonight, we will be providing a live medication instructional program on 3 fertility products: Minipure, Avadrill, and the Sonera patch. This will also include an interactive Q&A throughout the program. So join us on Zoom or Facebook Live and share your questions in either format. Each week, we have a different healthcare professional from across the nation to provide you with real-world experience, just as if you were sitting across from them at the clinic. Tonight, we are joined by Karen Hammond. She's a doctor of nursing practice. And thank you again for your time and interest. And I'm going to go ahead and turn it over to you, Karen.
Good evening, everyone. I'm really excited to talk to you tonight. As Tony said, I am a women's health nurse practitioner in Birmingham, Alabama, and I have been doing this for about 37 years now. So I'm really excited to share some of my experience and my recommendations for you for taking a few of these medications. I'd like to thank Tony for heading us up tonight, as well as the awesome people at Mandel's for starting this program and giving patients this opportunity to informally ask any questions that they may have. For general questions, we are more than happy to answer them. And for more specific questions related to your individual treatment and dosages, we're going to recommend that you talk with your provider and find out about what your individual needs are. So I'm going to talk to you about 3 different products tonight. The first one is going to be Minipure. Minipure is a subcutaneous injection, which means you just give it under the skin, and it contains 2 hormones. One of them is FSH, follicle stimulating hormone, and the other one is LH, luteinizing hormone. This medication works to help develop your ovaries to grow and develop and mature early eggs into more mature eggs. So let's go ahead and cue up the video if you would, and then I'll talk to you about how to do it, and afterwards I'll be happy to answer any questions you have. I'd like to talk with you about administering Minipure. If your prescriber has recommended that you take Minipure, it's given subcutaneously, which means in the fatty part of your skin. You can either generally give it in your lower abdomen or in your outer thigh. It's quite easy to mix it. It does take a few steps though. You need to start by taking a look at what your dosage is. Each bottle of the powder of Minipure contains 75 international units. So if you have been prescribed 150 units, you will need 2 vials of the powder. No matter how many vials of powder you'll still just use 1 cc of the liquid. So I like to start by opening up the tops from all of the bottles. So we're going to do a demonstration today for 150 units. So you'll need, again, 2 powders, and you just lift the top up of the vial of both powders. It actually just lifts up really easily. And then lift off the top of one of the liquids. The liquids are just a way to dissolve the powder. There's no medication in here. It's important you use this liquid, but don't worry, you'll probably have some liquids left over. The next step is to take a Q cap. You may not have ever seen one of these before, but you just open up the package and there's a little device that's in here that will just slip right onto the top of the ampule of the vial. So take the vial of liquid and just snap the Q cap right on top, just like that. Next, you'll take a syringe that will be provided with your medications, and it just screws right on top of the Q cap. Then the pretty cool part begins. Just draw back about a cc of liquid. If you get some air in there, that's okay. We'll have plenty of time to get that out. Once you get the liquid into the syringe, take off the syringe and the Q cap as one unit, and that has all of the liquid that you'll need. Next, you'll take the first vial of powder, attach the Q cap, squirt in all of the liquid, swirl it around a little bit, but it dissolves very quickly. Turn it upside down and withdraw that mixture. Now you have 75 units in the liquid in the syringe. Then take the Q cap and the syringe off as a single unit again, and put it on to the second powder. And it just snaps right on, squirt in the liquid, swirl it around a little bit to make sure it's all dissolved, and then draw up that mixture. After that's in there, you have both of the ampules of powder, the vials of powder in the syringe. Just unscrew it, and you're ready to put a needle on the top of it. And you can just take the tiny little needle right out of the package, and similarly, it'll just screw right on the tip of the syringe. And it's ready to give. When you give this injection, you might first want to take an alcohol pad and just swab the area that you want to give the injection. Then take the needle off, take the cup off the needle, bunch up the tissue, insert the needle straight in all the way, and then just push the medicine in. Release the plunger, wait a couple seconds, pull the needle straight out. If you need to, you can wipe the area with the alcohol prep and apply a bandage if you have a little bit of bleeding. But just like that, you've given your injection of Minipure. Perfect. So how easy was that? Just to mix it up. The first time you're going to do it, it's going to feel like it's a little bit of a science experiment, and you have to mix everything up. I always recommend that you gather all your supplies together first. Of course, wash your hands and use a clean work surface. And then when it's time to actually give the injection, it's just a matter of mixing it up and then giving it. The biggest question that people ask me is, how much is it going to hurt? So once in a while, the Minipure will sting a little bit. It'll just feel hot when it goes in, but any discomfort that you have goes away right away. I've never had a patient tell me that she doesn't want to take it anymore because it was painful, but you may feel it going in a little bit. Some of the medicines you feel, some of them you don't. The important thing is just to choose your site, pretty much anywhere on your lower abdomen, the back part of your arm back here, the outer part of your thigh. Just pinch an inch, put the needle straight in all the way, and give the medication. So I'll pause right here and see if there are any questions that y'all might have.
Yes. The first question for Minipure that we have is it normal for my provider to change the dose throughout my cycle?
That's a great question. And the reason you go in for monitoring is because it's really not one dose fits all. We make our best educated guess what we think is the right dose for you, but each cycle, and certainly each individual, can respond a little bit differently. So when you go in to have a monitoring visit, have an ultrasound, maybe blood tests, we may tell you to either go up or down on your dosage. And that is no cause for alarm. We just want to try to help you to have the best response you can possibly have.
And you kind of just touched on this again, but I guess just to kind of reiterate it, are there any best spots for me to inject the Minipure to prevent discomfort or improve the outcome?
Perfect. I do think, my experience has shown that patients really tolerate it best if you give it in your belly. I know that may be off-putting for some. I know when I was growing up, my mom told me not to pet stray animals because if they bit me, I'd have to get shots in my belly every day for a month because I'd have rabies. Since somebody's pet dog probably had rabies, that just kept me from messing with everybody's animals. But it was kind of a scary thing, especially when I was threatened that I'd have to get shots in my belly, that in my stomach. So I think it's just a stereotype or some kind of fear that we have. But really, I think that's the best place to give it. It's less likely, I've seen, to bruise if you give it in your belly than your thigh or the back of your arm. And it's a place that even really, really thin women can generally find a little bit of an inch to pinch right beneath their belly button and out to the side a little bit. So that's what I always recommend for my patients.
This next question is a good one. I get this one a lot in our clinic. Can the medications such as Minipure, can it cause my mood to change during treatment? If so, is there anything I can do to prevent that?
Gosh, that is a great question. And that's one I don't think I've been asked before on PharmAssist. And actually, if your mood is going to change at all when you're taking this medication, it's probably going to improve it because unlike medicines, especially Clomid or clomiphene citrate that you may have been prescribed previously, that's an oral fertility medicine, this works directly on your ovaries. Clomid kind of fools your brain into thinking you don't have any estrogen, so you get some of those anti-estrogen side effects as being, just not feel well, not feel yourself, maybe particularly that you have depression or mood swings. People generally don't like that, and the spouses don't really like it either. But with Minipure, it actually increases your estrogen, so it's all more in a favorable response. So Minipure, Follistim, Gone Left, they all do that. So if you feel anything different, you might actually feel a little bit better than you usually do. In fact, I've had people come back to me after they have a baby and want to know if there is a gonadotropin injection they can take just to make them feel better, because they never felt better than when they were taking drugs to stimulate their ovaries. Now, unfortunately, there's not. There's just one purpose for these medications for women, and that's to stimulate egg growth. But most people actually feel better. Now, you may have some other little symptoms that may not be quite as pleasant, like you might feel your ovaries as they get bigger and bigger. You might feel just some bloating, or when you walk around, it might feel like your ovaries are jarring a little bit inside you. Those things are all normal and just signs that the medicines are working.
I think that's all we have for the Minipure right now. If you want to add anything, otherwise we'll go ahead and move on to Avadrill.
Okay, perfect. So this is an easy medication, and if you've been prescribed this, the folks in your practice will definitely walk you through how to do it. But also, these videos are archived. You can go back through Facebook to Mandel's Pharmacy's Facebook page and find the archived videos from myself as well as a number of other healthcare providers from across the country. Or you can go to mymandels.com and you can take a look on the website at all the PharmAssist programs. So if you have no further questions right here, I'm going to go to the next product, and that is Avadrill. Avadrill is a medication that's given once your eggs or your follicles are all the way mature. And some people call it a trigger shot because it does the final maturing, and unless we do an egg retrieval, you'll release the eggs. So it kind of mimics the LH surge. If you have ever done home ovulation kits, it mimics the LH surge and does the final maturing of the egg. So they'll either be ripe for ovulation or for your egg retrieval. This medication is recombinant, which means it's man-made. It's manufactured in a laboratory as opposed to being human-derived. It's given sub-Q, just like the Minipure, Gonal-F and Follistim are. And this is probably the easiest injection you'll take because it's already mixed and ready to go, already in the syringe. So let's go ahead and move forward and show the video, and I'll answer some questions on the other side. I'd like to talk to you about administering Avadrill. If your prescriber has recommended you take Avadrill, chances are you were told to take it at a very specific time. Good news, it's very easy to give this injection. The Avadrill comes in a little package like this, and you simply open it up and remove the inside part like that. Fortunately, with this medicine, it's in a pre-filled syringe, so the medication is already drawn up, mixed, and ready to administer. You just pull the plastic tab off and then choose the site that you want to give the injection. Since this is a subcutaneous injection, that means it goes into the fat. Most people recommend that you take it beneath the belly button, out to the side an inch or two and down an inch or two, or either in the outer thigh. Once you select the site to give the injection, you can use an alcohol prep just to gently wipe the area. So you bunch up the tissue, wipe the area once with an alcohol prep, remove the top from the syringe, and then put the needle straight in, all the way, depress the plunger, release the tissue, release the plunger, pull the needle straight out. Afterwards, you should put the needle and syringe in its entirety directly into a sharps container to avoid getting stuck with it. Congratulations, you've now given your first injection of your Avadrill. Gosh, that really is an easy one. So that one is so self-explanatory. You'll already be a pro at giving the subcutaneous injection, so this is going to be a cakewalk for you. I will tell you that there are a couple of formulations. There's also, I told you that there's recombinant HCG, which is this one. There's also human-derived HCG that is a little bit more of a science project that you do have to mix just exactly like you do the Minipure, but they're pretty much used interchangeably. Your prescriber will tell you which one they think is best for you. But you can always ask them if you have questions. If you're prescribed one and you're taking another, I never mind patients asking me if they can change to a different formulation. So always feel comfortable asking your provider about that. So Tony, what questions do we have?
How soon after I inject Avadrill will I ovulate, and why is the timing so precise?
Great question. This is one of the medications that we will tell you exactly what time to take it. Because remember I said a minute ago that if you're not having an egg retrieval, it will cause the release of your eggs. So what we want to do is to go in and retrieve your eggs before you ovulate on your own. Generally, it takes about 40 hours or so, plus or minus a bit, before you'll actually release the eggs on your own. But most programs want you to take the HCG or the Avadrill somewhere between 35, 36, or 37 hours. Most people 35 or 36 hours. Your provider will tell you exactly what time to take it and exactly how many hours it is. So you do it just right. If you take the Avadrill or HCG too early, you might release the eggs before you get to a retrieval if you're doing IVF. If you take it too late, it may be that the eggs don't have the time that they need to do that final maturation. So this is one of the medications, probably the most important of all the medications to set an alarm clock for, since it's that a day and a half interval. A lot of times you have to take this medication when you might normally be sleeping. So you want to set an alarm clock, ask Siri to wake you up. You want to set lots of different kind of reminders just to make sure you do it. If you don't take it just at the right time, that is a time it's always appropriate to call your provider. If you're off by 10 or 15 or even 30 minutes, I probably wouldn't worry about it. But if it's anything more than that, you need to call your provider and run it by them. It's also important to consider, I know a lot of you may travel across time zones for your treatment. Go confirm with your provider which time zone it is to make sure you take it just at the right time. And let us know if there's any problem. Sometimes we can shift the time of your egg retrieval, but if it's way off, it may mean that your entire cycle is canceled. So it's very important that you take it on time and you communicate with us if there's some reason that you weren't able to take it on time.
Couldn't agree with those tips more. Definitely helpful to set a lot of alarms. I know we teach that. I had a teaching today and I was like, you cannot miss this. Set 1 to 2 alarms to make sure you wake up and then give yourself another 15 minutes. So very helpful. The next question we have is, what follicle size are we looking for before we trigger?
Gosh, that's a great question too. And not to put you off or anything, but that's a little bit individualized too. Part of it depends on the way that your providers or the sonographer, the nurse, or any other provider that you have does the ultrasound, whether they're measuring in 1, 2, or 3 dimensions. The more dimensions you measure, the smaller the follicle is going to be. I generally measure in 2 or 3 dimensions. So what I do would be different than what somebody that just measures in the biggest dimension of the follicle. Most people say they need to be between about 17 millimeters or 1.7 centimeters and about 20 millimeters or 2 centimeters. So somewhere the 17 to 20 range is going to be what most people say. But that is going to be totally dependent on what your professional thinks it needs to be and what works well for them. So always trust the people that are taking care of you with that.
Okay, the next question we have coming in is, are there any side effects that I can expect with the Avadrill?
Actually, there really aren't side effects with this medication, but there are symptoms that can happen afterwards. Once you take the Avadrill, since that is doing the final maturation of your eggs, your ovaries might get a little bit bigger. They're already growing from the follicles growing and developing from the ovarian stimulating medications that you're taking. And once you take the Avadrill, that means they're already pretty big. Then after an insemination or an egg retrieval, the leftover sac that did contain the eggs will then refill with fluid and a little bit of blood and produce a corpus luteum, which will help to make progesterone. So that actually ends up being a little bit bigger than the follicles. So your ovaries will get bigger and bigger and bigger within 2 to 5 days, even as much as a week after you take the Avadrill injection. So that's not really a side effect of the medication, but that's something that may well happen. You should probably plan on that.
Okay, that's all the questions we have right now for the Minipure. So I think we can move on to the Sanera patch when you're ready.
I'm ready. So the final medication that I'm going to talk to you about tonight is called Sanera patch. And the Sanera patch is something just to make your injections a little bit easier. I recommend this or offer it to all of my patients that are taking progesterone and oil because it kind of warms and numbs the site that the injection is given. It can be given when you're taking any medication that's given by injection, or even if you're having your blood drawn, which was originally what it was developed for. The important thing is you just put it on about 20 to 30 minutes before the needle goes in, and that just again warms and numbs the site where the needle will go in. These are often not covered or may not be covered by insurance. So I tell patients on their prescriptions, even I put it that they can get that on request. And I'd recommend that you talk to your provider about doing that too, because that means that the folks at Mandel's, when they get your prescription, they will check your insurance benefits. And if your insurance covers it, I would definitely do it. If insurance doesn't, then you need to think a little bit longer and harder about how much you dislike injections. The injections really aren't bad in and of themselves. People have done it for a long time without having any problems. But if you're really afraid of needles, this is a godsend. If your insurance doesn't cover it, they're about $10 a piece. So that's like a Starbucks coffee and muffin on the way into work every day if you want to try to rationalize it and see if, oh, which do I prefer? It is worth having the folks at Mandel's do a predetermination of your benefits just to see if there's coverage for it. It's kind of like putting on a Band-Aid. You just have to remember to do it about 20 or 30 minutes before your injection, but it's quite easy to do. No side effects, no risk. You might feel a little bit of warming and just a little bit of numbness at the site. I put one on me just to see what it's like, and I could feel that. I actually did it before I had blood drawn once to see what it was like. So let's show the video. So Tony, if you'll load that up, we'll show that. It's going to be kind of self-explanatory from that, and then I'll be happy to answer any final questions. I'd like to talk to you about applying the Sonera patch. This patch may have been prescribed to you, or at least offered to you by your healthcare provider just prior to giving your injections. If you particularly have a fear of needles, or if you're worried about one of the injections hurting, this patch may be a good alternative for you. To do this, you first want to take the patch out of the package just by opening it up. And it looks just like this, kind of like a big bandage. And there's a little opening right here where you can pull the patch off of the outer backing and apply it directly to the area, the sticky side, directly to the area where you're going to give the injection, and it'll just stick to the skin. In most cases, it's for progesterone, and you're just going to apply this directly to your hip. This part right here is medicated, and it will feel warm to the touch, and it numbs the skin down deep so that the injection will be fairly painless. It's important that you apply the patch about 30 minutes before you take the injection. When you're ready for your injection, you simply remove the patch, wipe the area with alcohol, and administer the injection. You may continue to feel a little bit of warmness or a little bit of numbness for up to an hour later. Perfect. So that's easy enough. So just a couple of little comments from that. You know, I mentioned that they're about $10 a piece if insurance doesn't cover it. The questions that patients most commonly ask me is, well, hey, maybe I should just cut them in half because it's just one little spot that the needle needs to go. If you do that, that kind of renders the patch totally unaffected. So don't do that. You can't reuse them. So once you apply them, you can't just carefully put it back on the little backing, the adhesive on the backing, and try to use it again. It's once it's used, it's used. But patients really do like them. So if your insurance does cover them, or if you want to spring for the extra $10 a day, patients really like them. I hear great feedback all the time. And I write on all my prescriptions for to dispense on request, so the people at Mandel's can go ahead and check your benefits. So Tony, what questions do we have about this one?
The first question we have is how long do the side effects, how long does it take effect for the patch to work?
You know, it starts working fairly quickly, but for it to have its full effect, it's going to be about 15, 20 minutes later. So I tell patients to leave it on for 15 but between 20 and 30 minutes, just to make sure that you get the full effect from it. If you forget and it stays on there for a little bit longer, you're not going to overdose on it, but it will wane in effectiveness. So try to time it as closely as you can. And if you forget to put it on, you either want to delay that injection of your progesterone, if that's the one that it is, just to allow the time, or maybe you want to forego using the patch for that time.
The next question we have coming in is there any risk of overdosing if you left the patch on for too long?
Yeah, no, there's no risk. There's no real risk for that, but I wouldn't leave it on any longer. You know, it's possible you could have a little skin irritation if you leave it on for a long time, but I think that's even unlikely. You're going to remember just to take it right off before you get the injection. And of course, no need to put it back on. You can discard it as soon as you take it off.
That was actually our next question, is how do you discard the patch?
The adhesive on it, great question. The adhesive on the patches is really sticky. So when you take it off, what I recommend to patients to do is just to fold it shut so that the adhesive is stuck on adhesive, and then you can just toss it in the trash. There's no worry about putting in any kind of biohazard bag or into your red sharps container box that's given to you by in your prescription box when you get all of your medicines. You can just fold it over on itself and toss it right in the wastebasket.
Kind of looks like that's all the questions we have on the patch. So I don't know if you want to touch on anything else that we talked about, wrap up any last things.
Sure. Yep. So I'd just like to thank you all again for joining us tonight. This is a program that is done every Monday night, hosted in the same site by the folks at Mandel's. It's the PharmAssist program that just brings an educational opportunity to patients. It's an open forum where you will be greeted and discussed with several healthcare providers from across the country, where we can just tell you what we think are the tips that you need to know about administering medications or using the various products that you may be prescribed by your fertility specialist. We're always here for you every Monday night. The pharmacist and staff at Mandel's Specialty Pharmacy are also available for you. They will do their best to get your insurance to cover what they can. They'll do the determination of benefits and send everything that has been prescribed for you in one nice, neat little box that has everything that you need in it. It's nicely labeled, so you know what needles and syringe will go with what medications, and everything that you need to know. And then again, they're also available by phone call. Finally, your best resource is always going to be your provider, because they know exactly what works for them, and they have the best knowledge about what will work for you. I never mind patients calling me. The only bad question is one that you didn't ask. So always feel free to ask any questions that you have of any of the people in your healthcare team, because the only people that want you to succeed as much as you do are your providers and those people cheering and coaching you from the sidelines.
Yes, I agree, Karen. So I just want to say thank you again for joining us tonight, sharing your wealth of knowledge. Thanks to everyone who joined us on Facebook and Zoom and sharing all your questions. I hope you guys learned something. If you didn't ask a question, I hope we were able to answer something for you. And just to reiterate what Karen said, all of the videos and the product demonstrations are on our YouTube page, the Facebook page, and then the mymandels.com PharmAssist page. We truly do believe the more you see something, the more it will stick in. So repetition leads to retention. And we look forward to seeing you guys here next week, Monday at 7 p.m. Eastern for another great program. And then anyone you think you could share the program with, just have them hop on. Every Monday night we do this. So a friend, a colleague, it's a really good opportunity to ask questions in a comfortable space. So thank you guys for joining us. See you next time, Karen. Y'all have a good evening.
Thank you. Thanks so much. Good night, y'all.